All right, Michelle, thanks. A recent study by the Good Food Institute showcased the harm of ultra-processed foods can have on our diets. And with so many options for weight loss, it's so hard to decide which one is right for you. So helping us kind of figure that out, Dr. Josh Long with AdventHealth Parker. Doctor, thank you so much for being here. We appreciate that. So there is a difference between ultra-processed food and processed food, just regular processed food, right? So what is the difference here?
Yeah, that's a very debatable question. There's not universal consensus on this, but if we use the definition of the U.S. Agricultural Association, processed foods would be foods that are cooked, frozen, diced up, or juiced, some way altered, but no additives have been added to them. When we get into the ultra-processed realm, what we're talking about is foods that have been significantly altered through additives such as food coloring, sweeteners, flavor enhancers, etc.
Yeah. When we go to the grocery store, and I find this I have 3 kids, so I just try to find the moderation here. But is it realistic to avoid ultra-processed altogether, or is simply, moderation being the goal here?
Yeah, these foods, it's important to note, were designed with intent. So the intent of these foods, they're made to be very attractive.
Right.
They're made to be very convenient for us, and they're made to generate profit. And so because of that, they're very easy for us to access in our lives. In fact, recent studies have indicated that 60% of U.S. adults, 60% of their diet is actually ultra-processed foods, whereas 70% of children are eating ultra-processed foods on a regular basis.
Wow, that is an eye-opening statistic for sure. All right, moving on to like weight loss drugs right now. We're talking, they're all the rage right now, talking about GLP-1 drugs. So how does this compare to, I guess, traditional bariatric surgery, right?
Right. Yeah, so GLP-1 drugs are drugs that are given to actually simulate some of the effects of bariatric surgery.
Okay.
And the interesting thing about this is that these drugs, while effective, and they're the social media rage right now, how effective are they in comparison to bariatric surgery? There was a recent head-to-head study that was reported at the ASMBS that found that bariatric surgery is 5 times as effective over a 2-year span as GLP-1 drugs. Another thing that is not commonly known about these GLP-1 drugs is that the assumption would be that the side effect profile is lower, whereas depending on the study and depending on the drug, the side effect profile actually ranges from between 48% on the low end to upwards of 83% on the high end.
Wow.
With some of the side effects being serious.
Yeah, that sounds like it. I would assume that the bariatric surgery would be more cost effective, I guess, right? Because you're paying hundreds of dollars for these GLP-1 drugs, right?
That's right, Brian. One of the interesting things is that many commercial payers will not pay for the GLP-1 drugs because surgery is much more cost-effective over the long haul.
Yeah. All right. And really, one last question here. I only have a few seconds left. But could GLP-1 drugs and bariatric surgery be used together for a treatment plan?
Absolutely, and we do it all the time.
Yeah.
And sometimes we can actually dovetail and enhance the effectiveness of a bariatric surgery or use them in segue to each other. GLP-1 drugs also are useful in treating diabetes and other metabolic processes and diseases, and certainly can be overlapped.
Yeah. All right. Doctor, thank you so much for being here. It's a great talk. We appreciate that. You can find all of our interviews, by the way, on our website at cbscolorado.com. Michelle?